So, Andrew, the first one to you is from Margot, and thank you, Margot. Why is there a link between hearing loss and dementia? And remember, there was that big study that came out recently, and certainly in the field I work in, which is trying to keep people as well as they possibly can, the fear of dementia-related illness is right up there with Australians as that aging population just continues to increase. So is there a link, Andrew?
There is a link, but I just want to emphasize it's not a causation. That doesn't mean that if you have hearing loss, you will get dementia. There are several reasons why all the big population study, especially the recent one from Canada, but they're also doing one in Europe and as well as in the UK, does show that if your hearing loss is not optimally treated, then it makes the dementia worse. There are some of the reasons for that. First one is that a lot of the tools that we use to test dementia doesn't actually take into account of your hearing loss. So if you've got a hearing loss, it is expected that you will do worse on those dementia screening tools. The other reason is that you are less likely to be engaged with your social and your environment. So a lot of times when you have a hearing loss, you are less likely to be engaged with your family, your friends, and you lose those opportunities to actually also therefore engage your cognitive function. And it is that sort of good old adage that if you don't use it, you will lose it. But also hearing loss is also a general sort of thing, like Tegan was saying, that, because you have this hearing loss, it's probably an indicator that there are other health issues that are going on in your life, which you may not actually have adequately addressed. So sometimes it is actually good to actually go and see your local audiologist as that first step into actually creating a better wellness for yourself.